All right, nitroglycerin. Nitroglycerin, NTG, nitro, nitrostat. There are multiple names for this little white pill. It also comes in a spray. Just getting that out there. So, nitroglycerin. And yes, it is a derivative of the explosive nitroglycerin. The class is nitrate. And its action is it relaxes vascular smooth muscle, causing vasodilation, decreased cardiac workload, and improved coronary blood flow, reducing oxygen demand. It's a mouthful, isn't it? So let's write it down. Relaxes vascular smooth muscle, causing vasodilation, decreasing cardiac work, improving coronary blood flow, and most importantly, reducing oxygen demand of the heart. Okay, so that's a lot of action. It relaxes vascular smooth muscle, causing vasodilation. So it's opening the arteries especially, because they're the muscular ones. Relaxes vascular smooth muscle, causing vasodilation, decreasing cardiac work, which improves coronary blood flow, also through the vasodilatory effect, reducing oxygen demand on the heart. That is a huge statement for such a little pill. This part, reducing oxygen demand of the heart. What does that do for us in an infarct or an ischemic event? Ischemia is increased oxygen demand without supply, correct? So it's starving for oxygen. It is ischemic, right? That's literally the definition. So if we're reducing the workload and improving the blood flow into the coronary muscles or into the heart muscle through the coronary artery system, thus delivering more blood, carrying more oxygen, while at the same time reducing the oxygen demand of the heart, what are we doing? We're fixing the ischemia, which relieves pain associated with heart or coronary artery syndrome or heart attack or acute myocardial infarction. You get where I'm going with this. That little pill with its vasodilatory effect also decreases the workload, improving coronary blood flow while reducing oxygen demand of the heart, while at the same time facilitating the delivery of more oxygen-rich blood. So, what are our indications? Chest pain. chest pain. Now, we talked about chest pain and AMI criteria of chest pain needing to last equal to or longer than 20 minutes to be considered myocardial infarction related, correct? That's what the books say. However, if you got a patient that is complaining of chest pain for the last 5 minutes, are you going to deny them nitroglycerin if they're still currently in pain when you get there? If it's indicated, no. You are not going to deny them that. Why? Because of this. And because of what it does and the potential help it may give to him and his heart. Okay? Congestive heart failure. Congestive heart failure. Why is it indicated congestive heart failure? For the vasodilatory effects and the decreased workload on the heart. How is it doing that? Well, what happens when you vasodilate somebody? You drop their blood pressure. You make more room in the container for the volume within the container. So, you've got congestive heart failure. Your patient is coughing up pink frothy sputum because blood is backing up into the lungs because it can't get to the left side to be pumped out fast enough because the left side of the heart is failing, which is ultimately leading to right heart failure, but we're not there quite yet. So the right heart is pumping, trying to get into the left. The left is going, hold it. You're going to have to hang on to some of that. The right heart's saying, I can't hang on to it. It's going into the lungs. That's where it goes. The vasculature leaks. It goes into the alveoli. You get wet lung sounds. Progresses far enough. You get pink frothy sputum. What is pink frothy sputum? That's blood, plasma, whatever is crossing in through those capillary beds into the alveoli and coming out through your mouth and nose. It's not a good situation. We don't want that there. So we create a bigger container, and that now has somewhere to go in the body, in the vasculature, where it belongs, and not in the lungs. Of course, it's not a 100% fix-all, right? This is very temporary because it wears off fairly quickly because we repeat doses of nitroglycerin every 5 minutes, correct? Up to 3 times per standing orders. So, we're giving this for chest pain, we're giving this congestive heart failure for different indications for similar reasons. Okay? So, how much are we giving? We're giving 0.4 milligrams sublingually under the tongue. Sublingual. Or 1 spray under the tongue. 1 spray also delivers approximately or the equivalent of 0.4 milligrams. Also under the tongue. Okay? So what's our contraindications? Well, what's it do? It causes vasodilation. So if you're already in and can potentially cause hypotension, what are you going to do? You don't want to give it to somebody who's already hypotensive. Right? We're not going to give it to somebody who's already hypotensive. Increased intracranial pressure. Okay, contraindication, increased intracranial pressure. If they have increased intracranial pressure, we've got other problems that we're dealing with. It's not a heart or a congestive heart failure problem. There is other things at work in that instance. Okay, so our adverse effects: headache, dizziness, nausea, vomiting, weakness, tachycardia. and hypotension. As we discussed with 12 leads, this is not recommended to be given in right heart failure unless you have an IV and you give them a bolus to start with. You could potentially bottom out blood pressure to a dangerous level. Also, contraindication is anybody that is taking I don't want to say specifically male enhancement or a male aid, because women take it too for varying reasons, but sildenafil or Viagra or Cialis or any of those medications, if they are taking those medications along and they have a heart issue and they have nitro, they are not to take them, and we are not to give them to those patients because, again, it can potentiate and it can drop the blood pressure even further. So we do not give with the little blue pill. Okay? All right, nitro, great drug, does great things, has good actions. It's a good med. Do not withhold this.